it's a balance between getting information and trusting experts. And it's really important that as a patient, you just have to be your own advocate and you have to decide who you can trust. Find those doctors, find those sources that you trust, and then work with them.
Hey, beautiful soul, and welcome to Dear Body, I'm Listening, the podcast for women navigating chronic symptoms, invisible illness, and that daily dance between hope and exhaustion. If you've ever been told it's all in your head, well, this podcast is for you because your body is not lying and neither are you. Hi, I'm Donna Piper, movement therapist, Pilates instructor, and chronic illness navigator. After years of being dismissed, misdiagnosed, and doing everything quote unquote right, but still getting sicker, I created this space to tell our truth. Here we talk about swelling, brain fog, nervous system crashes, and the kind of symptoms that don't always show up on lab results. We're going to explore lymph, breath, movement, self-trust, latest research, books, relationships, basically everything. All from a place of compassion and honesty. This isn't about fixing your body. It's about finally being heard and getting some answers.
Hi, and welcome back, listeners. I'm really excited to be talking today with Dr. Robert Kane. He is a board-certified clinical thermologist and international authority on women's breast and whole body thermography. With nearly 3 decades of experience, he is dedicated to bringing science-based imaging into women's wellness and preventative care. Through his work at Kane Thermal Imaging, Dr. Kane combines cutting-edge technology with a compassionate educational approach, helping practitioners and patients understand what the body's heat patterns can reveal about hormone balance, inflammation, vascular health, and early signs of imbalance. So without any further ado, welcome, Dr. Kane.
Well, first of all, thank you for having me on your podcast. I really appreciate the opportunity to talk. It's been fun getting to know you a little bit before we went on, and I'm really excited to talk to your listeners and, perhaps give another perspective on how women can take control of their health and really be empowered in the doctor's office and know how to drive things. So for me, I've been in this for 30 years. My background is chiropractic. I initially got into thermal imaging as a way to look and see how my chiropractic was affecting the body. Now, for those of you that have never heard about thermal imaging, what it is, as the name sounds, temperature measurement. We actually take a picture, and you can see one on the back wall here, right about there. Trying to do this
Perfect.
Looking forward. And what it does is it maps out the patterns of heat coming naturally from your body. And in those patterns of heat, we can get indications of inflammation, circulation, tissue function, and sometimes even a growing cancer.
Oh, wow.
So, this was very exciting to me as a pain specialist in chiropractic. And then eventually my interest got towards the breast arena, and I got certified and trained under one of the world's leaders in breast thermography, Dr. named William Hobbins. And since 2003, I've been doing thermography exclusively.
Oh, that's really exciting. So many things you said that I want to dive into. First, what led you to general thermal imaging to the breast specifically?
Yeah, it's a great question because initially I did not want to specialize in breast imaging, really because I'm a chiropractor. It just didn't seem appropriate at the time. But when I was working with this Dr. Hobbins, initially he was reading for me and he said to me, look, he goes, you are qualified to be able to do this. You are not diagnosing breast cancer. You are simply reading thermal patterns and giving that information to physicians to work with. And then, as we'll talk about later on, to holistic physicians to work with so that we can look at prevention. But you're not overstepping your bounds. And being in Redwood City, California, this is the Bay Area. This is the breast cancer capital of the US. So I can't tell you how many patients would come in my office for chiropractic that had breast cancer. And I'm sitting on technology that could work with it. There was absolutely no way I was just going to sit on it and not make this available.
Oh, that's wonderful. That's really a beautiful sentiment because it's so prevalent, breast cancer. so many, I don't know anyone that doesn't know anyone directly, maybe in a family or friend close. It's not like 6 degrees of separation like you heard of a friend that has it. I mean, it's very prevalent. And there is a lot of talk between mammograms, depending on what you think about mammograms. Should you have them? Should you not? The radiation. What are your takes about traditional mammograms and also how thermal imaging can help it, like be another tool with it?
Yeah, it's a great question because, I have a lot of women that talk to me and they're very concerned about mammography. It's uncomfortable. They're concerned about the radiation. Yet there is information that only the mammogram can provide. So I'm of the fan of using technologies appropriately, not demonizing one and glorifying another. We see the role in the profession of thermography as an adjunct. It's something to be used in addition to common radiology. And doing that, we've seen studies now that have shown detection rates are higher. So you've got a mammogram that maybe shows 80 to 90% accuracy on detecting cancer. We've seen that number go up to 95% when we add thermography into the mix. So the thermal imaging, and I use those terms interchangeably, thermography and thermal imaging, it's almost like taking a new set of glasses on that allows you to see different things than the first set of glasses are.
So what is kind of like a general, so this is not medical advice, everyone, again.
Yeah.
This is for information and just so that listeners know, like we're not saying one or the other. But what would be a nice protocol? So if you get yearly or bi-yearly mammograms, depending on your age or history, then when would you add the thermal imaging? Would you do it at the same time, after, or should you do some thermal imaging more often through the year for detection or prevention?
Yeah, it's a great question. And what I would say is, for the most part, we leave radiology in the hands of the medical doctors that are running that particular patient's case because they know that person. They can work with their idiosyncrasies, their particular conditions and risk factors. The thermography, we recommend that it start actually as early as age 20. Not because we're expecting to find problems, but because we want to get baseline information. This is a test of breast tissue function. So we want to get a feel for how does your breast tissue look? We have our averages of normal, but let's now tailor that to be specific for you. And then we can look for deviations from that. Once we hit 30, we recommend that they're done annually for the same reason. Now, if we see signs of a developing concern, we can get that back to a physician's office where they can evaluate it and see if it's something serious. In doing that, sometimes we've actually been able to catch things earlier than when a mammogram was being prescribed. Or if someone was having a yearly mammogram, it forced an additional test, an ultrasound, an MRI that detected the cancer that was missed on the mammogram. So the idea is to weave it into the protocol every 3 years for women between 20 and 30, and then yearly for women 30 and above. And that can be modified depending if we see concerning thermal findings, if they're monitoring an existing condition, a lump, a mass. We can play with that because there's no radiation, there's no harm. So you could do the thermal imaging every day if you really wanted to, even though there's no reason, but there's no side effects from it.
Oh, that's beautiful. That's a nice tool and it's good to know to have a baseline because typically when you do your first mammogram, like that's your baseline. They haven't looked before, and I'm older, so mine started a while, so I'm 54.
Mhm.
So with mine, I had more dense tissue. So they always are like, oh, like could be something. And then now that the imaging has gotten better with technology, I get less of those calls about like, oh, it might be something. Is it just dense tissue or is it something? So I think also with this technology, it could just aid in that, like what to give your provider and some more information too. I think the more information we have about our body and how it works, the better. So you
Yeah.
can't go wrong, especially having a nice baseline in your 20s and then you mature. So, and I do like that you're just saying like you're a medical doctor, your medical team, they have their protocols and you adhere to those. And then this is just an added tool that could either help go deeper to find something faster if it's smaller, or who knows, if there's abnormalities in that, you could maybe it's not breast cancer, but maybe it's something else.
Right,
That
exactly. And, you mentioned the idea of breast density, and this is something that's just come out in the last 5 years. The number of women, number one, with overall breast density, and number two, how that's now actually being considered a risk factor for breast cancer because it's estrogen driven. And not that all estrogen is bad, but the types of estrogen that cause breast density can at times be driving cancer. But the density makes it harder to see things on mammograms. So wouldn't it be nice to see what the tissue is doing, to see if there are any thermal signals saying, hey, something looks like it's growing here, something looks like it's active here. Maybe instead of watching and waiting, we should run another test now and make sure that nothing's going on to protect the patient.
So with that, because I told you a little bit of my story, but me and doctors don't always see eye to eye.
Yeah.
I've gotten a lot of misdiagnosis and pushback and things. So you have to really be your own advocate and really stay in there with your doctors. But how open are doctors? Have you seen if I started this when I was 20 and I had my baseline, and then as I go up and I have dense tissue, and I'm like, here's my thermal imaging as well. Are they pretty open to seeing what's on there? I'm sure you write a report and maybe you're part of that process, but how does someone go to their primary care or whoever's giving their test after the radiologist does their report to say, hey, maybe I want to look at this further?
Right. No, and it's, to be honest, I wish that it was widely adopted at this point, but it's a new technology. It's a new innovation. So most doctors will not understand it. They will probably perceive it as being sold as a replacement to a mammogram. So it may be a little rough in the beginning to try to educate them as to what's going on. I would suggest women give them the reports. The reports are very clear. I'm available. I consult with doctors routinely if they need information on what these reports mean and how it integrates into their standard of care. But if they don't even want to deal with that, because sometimes that's just a lot to carry as a patient, you could just simply say, if there's something on the thermal image that's of concern, you could just say, hey, can we run an additional test because I'm scared? Doctors generally will run the additional test when it comes to something like cancer because they're afraid of missing something as well. I mean, nobody wants to put a patient in danger. And if there's somebody who's genuinely scared, whether it's because of a test or because they had other risk factors, and they say, could we just run something just to give me peace of mind? A lot of doctors will just do that. And then often after the fact, they'll sit there and say, wow, that thermal imaging thing picked it up. I'm glad we ran it and we took that extra step.
Oh, that's beautiful. It's very simple. It's not that you're trying to educate your doctor or even prove that this test shows something. It's more like, I don't feel confident and I'm scared that this might turn into something. And saying those words that way is also gets probably, get your doctor on board with what you're doing. Because, sometimes doctors don't like to have any sort of outside influence if they have, everyone's different, but some aren't as open to hey, I won this other thing and I did this test. I want you to do stuff. But having that conversation, and I love those words that you said, just simply, I'm scared and I would have, for the peace of mind, can we run this test? And
Yeah.
if nothing comes back, great. But if something does, then that's also great because then the process of care could be sped up. Being in the oncology world isn't also super fast. My mother just got diagnosed with lung cancer. I think it was 2021, and it took her 9 months in order to get radiology treatment. And she's older, and lung cancer
wow.
usually metastasizes. So, luckily it didn't. But
Yeah.
trying to get into the system to see the doctors, to see the right people, having those words, it really does, I think, make a difference. So
Yeah.
thanks
No,
for that
it can be
insight.
challenging. I agree.
Yeah. So the other thing you said that I wasn't expecting, but it's a perfect segue, is estrogen. So I have dense tissue, breast tissue, and you said that was high estrogen. I don't know if any of my doctors ever said that or whatever you said. You can clarify my words. I'm misspeaking. I'm sure misrepresenting. But I also have something called lipedema, which is a fat disorder, which is diseased adipose tissue that grows abnormally in different areas of your body. And there is hormone driven, specifically estrogen driven, and they're
Mhm.
not sure which like why. They don't understand, like, does it make more or less? And every person is a little different that also has lipedema that might have estrogen. But puberty, pregnancy, and menopause are the times where you can actually grow in volume in those areas that are affected with diseased fat tissue. So with that, and also you talked about pain, having been a chiropractor, being in pain, and the thermal imaging, looking at pain. Chronic pain is something that definitely I have, and most women with lipedema have, like this heavy pain in their legs. Are you familiar with lipedema as a physician, or is it newer to you? Not everyone is. It's not taught in medical schools. It's more
No,
random.
I understand the general condition, but I'm not familiar with the specifics. So I couldn't speak to the condition and
Okay.
how to manage it.
Okay. That's
Yeah.
typical. Like, it's not, because it isn't taught. And there is a significant amount of pain. So let's kind of riff on, like, if someone comes in, if I got a scan, you would probably, because I also have chronic fatigue syndrome, I have mast cell activation syndrome, and I have hypermobility EDS and POTS. So I'm lucky I have the jackpot of all. Like, they're all sort of vascular, lymphatic, and then dysautonomia. So there's definitely different things going on, like hot and cold. Different areas aren't really supposed to be hot, and they are, vice versa. So looking at, like, the scan of me, I know, like, breasts would show the density. Is there any indication, like, if you saw that and maybe the pain, maybe to do a referral to kind of figure out more about this? And I know this is totally off topic and we didn't discuss
No,
this.
no, this is great. This is great. Let's pick what you said apart bit by bit, and because it could be a great way to illustrate what the technology can do.
Perfect.
So number one, we talked about estrogen, and estrogen's normal. It's not that estrogen's bad. You need it. It's one of the primary female hormones, and men have it too. But sometimes it can be overactive, especially in breast tissue. And when it is, it can cause things like breast pain, cysts, fibrocysts, cramping, things like that. And it also could be a driver of cancer. Now, with the thermal imaging, what we've discovered is that the estrogen that naturally occurs in the breasts, when it starts to get into higher concentrations or it's not eliminated properly, it can overstimulate the tissue receptors. And what we see is blood vessels that look very much the same as a woman who's pregnant or breastfeeding. So if I see a woman who's postmenopausal and she looks like she's ready to breastfeed, and she's not on estrogen replacement, she's not taking supplements to stimulate estrogen, she's just like that, one of the things I'm going to suspect in my gamut of things that could explain this is an estrogen imbalance in the breasts. So doing a breast scan on someone like you with lipedema, which is an estrogen imbalance, would be helpful to see if you're predisposed to any of this. Okay, so that would be the first place that I would start. The second place I would start is, you mentioned things like chronic fatigue. There was a couple of other systemic conditions that you mentioned, but I would want to take a look at the upper body. And that would be the face, the neck, the arms, and the back, and the chest. Because what that could let me do is, number one, look at lymph flow going up and down to see if there are any patterns to suggest an impairment or an overactivation of the lymph pathways. I could see if there's any musculoskeletal contributors to pain, like joint inflammation, muscle trigger points, things like that. And then by looking at the inner eyes, we can actually get the temperature of the brain and see how brain functioning is working. So it's a little different than a brain scan. It's not quite as specific, but what we've noticed is patients with fibromyalgia and chronic fatigue often have elevated or dropped brain temperature. So we can document that. And then when they're being treated, instead of just going after symptoms, we could see, did we normalize the brain temperature at all? And that could be a parameter of outcome versus simply symptoms, which unfortunately, as you know, is the main way many of these diseases are being managed. Do you feel better? I mean, it's important, but the trick is, you don't want to stop a treatment too early, because if you go 2 more days, it's going to work. But how do you know? Well, something like thermal imaging could give you feedback to say, hey, hold the course for a little bit. The body's changing. Let's give it a little more time. Or the body hasn't really changed at all. I think this one's run its course. Let's switch to the next treatment.
Now that would be gold because there isn't a diagnostic tool and a standardization and like what does really feeling better mean, like daily functioning of activities, but you're familiar with fibromyalgia and chronic fatigue. In order to heal, you have to do a lot of resting and pare back what you're doing because your body is already taxed. So by doing more actually is worse. So to have a diagnostic tool just to kind of monitor, like, okay, I've done these 5 things. Are they working? If I add this one thing, how does that affect the whole system? Because it is a hard thing. Because luckily, they've had some studies out of Edinburgh about chronic fatigue. And now with long COVID, they're seeing all that together as well. But
Right.
that it is a brain issue. So your brain still thinks that you're sick. So it's interesting that you could kind of temp out what the brain is through the eyes. So to give you, is it hot or is it cold? It needs to be at this normal range. And it gives you more information and maybe probably sooner than when the symptoms, I think a lot of things, and you can speak to this in a more medical degree profession, but I think a lot of things happen internally before maybe you see a symptom or the symptom becomes a negative to your lifestyle. So I think probably this technology can see the changing patterns sooner, if I'm understanding that correctly.
Yeah, that's exactly right. Because what happens is before we get symptoms, there's a change in body function. So the body's a beautiful orchestrated balance of different functions and processes that are just, it's like a symphony, the way it's orchestrated. I bang my hand. I don't have to think about it. It heals, right? All of that happens automatically and it's under neurological control. Now, generally, what will happen in terms of injury and disease, well, in terms of disease, is that something has overwhelmed or overloaded the system. Something has created imbalance in the system. And that the imbalance can go just so long before the body expresses it as a symptom or a clinical sign. Now, if we can uncover the dysfunction first and reverse it, then we have the best chance of preventing disease.
That's beautiful.
Right. And this is exactly what we're looking at in the breast cancer department, too, because right now there are no proven scientific methods of preventing breast cancer. However, there have been scientifically identified risk markers for cancer that are modifiable. We know diet plays a role. We know lifestyle plays a role. You can go on the Mayo Clinic site and you can read what those things are. But what we haven't had up until now is something dynamic enough to let us know, are those things really improving the breasts? So a woman can now go in and get a baseline. She finds there's thermal activity in one of her breasts. Okay, she goes to her doctor. Her doctor clears her. Hey, there's no cancer. Okay, no problem. What we now have is a risk marker for the future. So this woman is now statistically at a higher risk of developing cancer in the future, just like if she had a family history or a gene. It's not a guarantee, but it's a statistical tendency. She can now take control, take action, modify lifestyle, modify diet, work with a holistic practitioner, and do interventions designed to lower risk factors and get real-time feedback to see, did those things actually work? This is the first time we've been able to do this. And to me, this is the future of medicine because we're moving towards prevention. So before we can actually say we can prevent breast cancer, we need to start looking at what are the ways that it's possible and getting feedback on it to see which are the approaches that we need to do the big ticket research on.
So just as a research question,
Yeah.
have you been able to fund a lot of studies with the thermal imaging or having I know for like lipedema and a few other things, there's a clinical trial up at Stanford right now about maybe getting an oral medication that can maybe help the tissue and stuff. But Dr. Roxon, he's like a professor there. So it's a whole thing, right? But it's not, chronic fatigue, lipedema, POTS, EDS, there's very big, like the smaller group, like grassroots, like really talk about it. But my understanding from, and I could be wrong, but in order for like companies that either, if there is like a medication for it or something, that the NIH has to at least spend $1 billion in their own research before any other outside company will look at it and say, hey, maybe we should do these tests. Maybe this is something.
Mhm.
Is that applicable in this world, or do you get funding? Are you able to do studies? Or maybe not you, but the world of
Yeah,
thermography?
overall from the profession, I mean, there has been over the years some funding from NIH. Department of Defense actually funded a couple of breast studies back in the 1990s, believe it or not, just because it was infrared and that's the technology. So they were willing to play ball. But most of the studies right now are being funded privately by university grants. Most of them are looking at artificial intelligence algorithms to improve diagnostic capability. In holistic, we're using it more from a functional aspect. It's less about making the diagnosis. It's more about, is there a process in the body that might be out of balance that we can correct? Getting funding for those kind of things is much harder because it's softer. If you're going after diagnostics, now you bring pharmacology into it or you bring surgery into it. It fits that algorithm and there's more money available for that kind of research. So, you've probably noticed it with some of the holistic stuff you've done. You can sit there and say, well, it's not scientific. Well, that's because nobody wants to spend money on it to make it scientific. And it's changing a bit. It's not completely all or none, but there's certainly more money available for surgery approaches and for pharmacological approaches.
Yeah, definitely. And anecdotally is like when you talk to a lot of groups or women that have certain things, you see what works. But again, the bigger companies to fund that don't always look at the anecdotal sort of things. But it sounds like this when if you're a functional doctor or your doctor does incorporate this or is open to having the thermal imaging, as you were saying, the prevention for the breast cancer of the, potentially if a woman, if you look like it have signs of breast cancer, but you're clear and she starts to change her diet, then you can use the imaging to see if there's changes like you talked about the brain, right?
Right.
You kind of know which diet. So maybe going to a diet that is suspected to be very helpful. If there's no change in that, she can course correct and maybe change different dietary things or come up with different supplements or things that are needed, because other than just being like, okay, I suspect that I could get this, I'm going to change my eating and then still end up with it because maybe there was something missed with just the nutrient part of it. Does that make
No,
sense?
it's exactly right. Like, for example, there's a lot of research coming out right now that, beets will increase a chemical called nitric oxide in the blood, and that could be used to reduce blood pressure. So it's very easy to sit there and say, oh, I'm just eating a lot of beets in my diet. But with blood pressure, we have feedback, right? I could sit there and try, I'm going to eat beets in my diet for a month, and I'm going to measure my blood pressure and see, did it actually go down? And I get that feedback. Now, with breast health, we really haven't had that feedback because there's very little testing that we're doing that's looking at breast function. PET scan is, but we're not going to do PET scans on people to monitor holistic wellness programs. It's an invasive test. It's expensive. It's just not the right test for it. But to have something non-invasive that can give real-time feedback as to what the effects were on the physiology, I mean, it's a golden opportunity we've got right now.
Yeah, I think it's really, especially when you said the future of medicine is more preventative. I know before we talked a little bit about medicine 3.0, you educated me a little bit about that. I think this is a perfect time to kind of talk about that, like looking at the exciting like frontier of taking your health into your own hands. Because as an aside, I think all women and anyone listening to this podcast, and sure all the people that you interact with, Dr. Kane, throughout, part of getting the right diagnosis or getting your health where you like it, you always have to be your own advocate.
Mm.
And you can advocate more if you have more information about what you're trying to get, and how to have common terms with your doctors and things. But if you can explain medicine 3.0, because that's an exciting part to prevent this, we don't have to go on medication or get surgery, etc.
Sure. Well, there's a medical doctor named Peter Attia, and he wrote a book called Outlive several years ago. And his idea was, how do we get people not just to live longer, but live better? And he talks about the idea that, even though our lifespan is increasing over the years, our health span, our quality of life is not. So most people that are getting older are not aging well. So they're having chronic diseases, which turn into physical limitations and a lower quality of life. So he talked about that medicine 2.0, which is where we're at right now. And he coined these terms. Is medicine 1.0, by the way, that's when there was no scientific method. That was pray to the gods and put leeches on people and hope they get better. Medicine 2.0 said, wow, there's something called the scientific method, and I might be able to reproduce these findings and really understand how things are working better. But medicine 3.0 is the next leap. And medicine 3.0 is when we move past managing chronic disease and we move towards the prevention of chronic disease. And he identifies cancer, breast cancer being a part of that, diabetes and cardiovascular diseases as the major ones. So he says, rather than simply waiting till we have the disease and then determining how to manage it, what are the risk factors and what are the ways we can provide feedback to make sure that as we change those risk factors and reduce them, that our body is responding. And when I read his book a couple of years ago, I just said, you just described exactly how I've been using thermography for the last 10 years. It's the perfect description. So that's what we want to go to, not just with breast health, with everything. How do we take control? And this is my big message in my practice. I'm a real advocate for people taking control of their own health. And here's the difference. When we don't take control, it's almost like we're going to our parents and saying, Mommy, Daddy, what do? I don't know. I'm too small. The flip side of that one is, I don't care what my doctor said. I saw something on the internet, so I know better. That's also parental that's just the adolescent version of it, right?
Yeah, exactly.
But the adult version of it is, this is my body, this is my health and my life. I run the show, but I need expert opinions because I don't know everything. So my doctor, that's one expert opinion. My specialist, that's another expert opinion. This holistic provider, that's another expert opinion. And I'm going to sit with all those opinions and make my own decisions. And what I'm about in my practice is making sure we have the tools so those people that are driving their decisions in breast health and in pain management, have the tools they need to make those informed decisions.
That's wonderful. Now, is it widely available? I know we're both in the California coast area, but is thermal imaging, where can people find it? And I also want to talk a little bit more. I know you educate people around this whole sort of to have the machines and what it is and how to use them. So I'd like to talk a little bit more in depth that in the moment. But is there a lot of places where they could go if I was like, I'm just going to use Google, Doctor Find?
Yeah.
Can I find just thermal imaging, or would I have to go get assessments, or how does the process work when you want to go get thermal imaging?
Right. Well, the variability depends on the state that you're in. Some states there's a little more concentrated, and some states they're not. Generally, they're available either through standalone facilities that are offering the imaging, or through holistic practices. That could be an acupuncturist, a naturopath, an integrative medical doctor. But it's not available in hospitals and teaching facilities and of that sort. So you're not going to find one at Stanford. There's two associations I'm a part of that I think have reputable people out there doing it, and they have lists on their sites. One is the International Academy of Clinical Thermology, and I can give you that link. We can put it in show notes later. And the other is the American Academy of Thermology. I've sat on the board of both. Well, actually, I've sat on the board of the International Academy. The AAT, I'm not on the board, but I've sat on their advisory committees to create standards and guidelines. And the reason why I like them is because it's very important that these tests are done properly under the right conditions. And both of those associations have good, clear, credible scientific guidelines for how the test should be performed and what it says and what it doesn't say, so that when you get results, you know they're accurate and you know they're not overstepping their bounds.
Oh, that's great. And what does the machine look like? Does it you step into something? Is it like an X-ray machine? Is it something you like lie down and move through? Or what can you expect as far as so people know kind of what
Yeah,
kind of
it's a great
machine,
question.
right?
I'm surprised I didn't
they're
offer
like,
that in the beginning.
well, I didn't ask you. We went right into it, to the
Yeah.
good science stuff. But so if people go into a thermal imaging and they're like, they hear what it's supposed to be, and it's not like that at all. They can kind of ask questions.
Yeah. I mean, there's a little bit of variation from different units, but basically it's a camera. So
Okay.
it could be anything from a handheld camera about this big, or it could look like a box. What's the three-dimensional version of a rectangle? That
Yeah.
box shape where it's more rectangular versus
Like,
a square box versus a square box.
okay.
But it looks like that. And it's not even touching the body. It's put on a camera stand and you're positioned in front of it, just like you would be positioned for your family photos.
Okay. And then do you do the front, backs, and sides, and then do you do the eye? Like, is there a standard thing like they check? Like,
Yeah.
so if they checked me for everything, they would also check my eyes to see my brain. And then there I could have known, like, oh, it's really hot. You should maybe go see something, and maybe that would have good
Right.
my chronic
Yeah. The
fatigue. Or
series is based upon what you come in with.
okay.
So, the average asymptomatic person, I mean, there's a lot of women that just come in for their breast health. So we would just do the breast imaging and we do front, sides, obliques, things like that, under surfaces. If you came in with something like what you're talking about, I would, probably want to do the upper body, including the head and the torso and the arms and hands. If somebody had a complaint in the lower back or their lower body, I would want to add those images to it. So there's some flexibility based upon what your concern is and what we're trying to evaluate with you.
Okay. So if some lymphatics, would you do the whole body with the lymphatics, like the lower as well? Or is that something you would want to ask? Say any listener has lipedema, usually their legs, it's not always, it's indifferent, but usually their legs are where the bulk of the fat disease is,
Yeah.
either in the lower extremities, and maybe they don't even know. A lot of women don't even know they have it. It's pretty common, but very underdiagnosed. So would you need to ask, or anyone? So I'm just really asking. So if any listener suspects after listening to me, they have all of my things like MCAS and I want to
Right.
talk about that one for a little bit, but definitely like lipedema or chronic fatigue syndrome. And we'll talk about EDS. That might be a little bit more
Yeah.
subjective.
And chronic fatigue, fibromyalgia, I would definitely want the upper body. If they
Okay.
had symptoms or were suspicious that there could be something going on that could develop into symptoms, then we could do the lower body as well. So, like I said, there's some flexibility on that. But if we know what you're looking for, then it's easier to prescribe what area of the body. I mean, certainly you're welcome to do the whole body and just get the information. There's no harm in doing that. But if you're concerned about costs and is this really needed, we would base that upon any symptoms you're experiencing, any clinical signs, and what the diagnosis is coming in.
And so what is the cost about that? Is it pretty expensive? And is it usually, I'm assuming it's not covered by your insurance since it's not affiliated with
Yeah, insurance
hospital.
doesn't cover it, but most HSAs and FSAs do.
Okay.
So there is reimbursement through that. There are some nonprofits that have grants that will cover it. And for pain studies, there are limited situations where it can be covered by insurance as well. I would say there's variation throughout the country depending on what state somebody's located in, but breast thermography wouldn't be more than $250 for the breast imaging, upper body, lower body, maybe 300, 350, something like that per region. So it's not that expensive when it comes to testing. It's not like going into an MRI, paying out of pocket and getting hit with a $2,000 bill.
Okay. And it really, obviously, the market dictates the price. But in general, you want to look at the people that on those two websites that you will provide it, and we'll link in the show notes to find a provider. And then also the cost is usually wherever, like probably Southern California, Northern California is going to be more expensive maybe than another economy that it has less,
Yeah,
you
that's
know.
exactly right. I mean, I've got a client right now that I do interpretation for in South Africa. And when she told me what the economy was like that was down there, I realized that we had to set up special pricing because I don't charge a lot for interpretation. It's really very reasonable. If somebody wanted to get into this, it's not the biggest cost of the practice. But at the same time, my costs were prohibitive to her. So we just had to adjust for the economy so that we can make it available for those people.
Oh, good. That's good to know that.
Yeah.
Because Like everything, being sick is expensive, right?
Yeah.
I mean, and the doctors and everyone, I'm all for paying the people that need to be paid, and it's not that, but all these things do add up when it comes down to it, especially when you're trying to figure out like what's going on with you and you're
Yeah.
trying different things. So you talked about you read for it. So the imaging, can you walk me through a little bit, like say, so first, do you need to be a licensed either chiropractor or doctor, or can you just be licensed to touch people's bodies like so in the state of California, I think for a lot of different things you have to have a license to touch someone's body, like a
Mm.
massage therapy license. And you can do other modalities like counter strain and things like that. So what are the criteria that you would have to have in order to learn this technology? And what are the process to actually learn it and get the camera and set up either a clinic or
Yeah.
services?
Yeah. So if somebody wanted to learn how to interpret the thermal images, there's no licensing requirement to learn how to use it. On the other hand, what you're using it for would be subject for licensing requirements. So if you're using it in if you're making medical decisions and medical calls in your interpretation, you need to have some sort of license that warrants to do that. So a chiropractor is what's called portal of care. We're somebody that you can see and we know where to refer people. It's similar to what a primary care doctor would be. There's just a little bit of a difference there. So getting the education is one part. How you use the education is where the licensing comes in. Now, what I'm finding in my practice is that there's a lot of people that want to incorporate the technology into their practices, but they don't want to take the time to learn how to read because it is a learning curve. So they do what they do with radiology. They have maybe a cursory understanding of it, but then they send things out to be professionally read. And that's where I would come in. People, I have doctors and technicians that send me images, they send me history information, and then I cross correlate everything with the thermal patterns and then give them feedback as to what I think might be going on in the body.
Oh, great. So they can have the technology in their office, but also
Yeah.
have you as a resource. Do you do those trainings? Do you offer anything like that you conduct or have to offer for practitioners on either of those routes, whether they just want to learn how to use the equipment and or if they want to learn how to read the
Yeah,
actual?
currently have a training course for technicians to have them set up the lab and capture images properly. As I said, there's a lot of protocols involved in this. So we want to make sure that they understand it and they also have an understanding as to what it's going to be used for. I'm in developing right now some very simplistic interpretation courses. These are designed for limited application, meaning it's not going to get you the knowledge base that I have, but it will be enough for you to either follow along with a professionally generated report or do limited interpretation in your own practice. So, for example, I work with a lot of doctors that are doing gut health, right? Probiotic balances, the microbiome and things like that. And they just want to see, is the abdomen temperature in a generally normal state of homeostasis or is it altered? They're not interested in knowing what organ could that be or what diagnostic criteria is that. All they want to know is normal, abnormal. So I'm looking at teaching some of those basics so that if they're just looking to get some feedback, they've gotten their diagnostics everywhere else, but they want to do, let's say, a colonic or a GI flush or some kind of detoxification or introduce new probiotics, they can do pre and post imaging and get that data very quickly.
Okay. And if they're interested or anyone out there listening, would they just go to your website or do you conduct it yourself or are you a teacher through a different organization?
Yeah, I'd say they should get in touch with me through my website. And then what I'll do is either address it myself or send them to the right place where they need to go.
Okay, great. And then is the equipment itself a huge investment? Is it very expensive to get the thermal imaging
Yeah, if
equipment?
somebody wanted to buy the equipment, I'd say average camera costs for the whole system is between 20 and 40,000. You don't need the $40,000 ones. Those just have a lot of bells and whistles that are convenient. So if you've had that to invest, great. But if you go for a camera down in the low 20,000, you're not going to get a bad unit. And it'll end up coming out on a lease program, we're talking maybe $500 a month.
Oh, that's great.
Yeah,
And
not
it's a
bad.
nice addition tool. So it's not really that cost prohibitive to do it. And the education part that they could hire you to do the interpretation. So
Right. Or if they want to do
upfront,
it on their own, I can direct them to the associations where they can get more formal training. I'm happy either or. I just find a lot of doctors get excited and then they're faced with the enormous amount of things they're doing on a daily basis. And this just becomes one more thing for them to do. And now you have a very expensive piece of furniture in your office that isn't being used.
yeah, exactly. I mean, it does sound like, oh, this would be great, but then you really do want the knowledge to how to use it and to interpret effectively for whatever your parameters is of your practice and whatever your scope is.
Yeah. I
Uh,
mean, my whole interpretation business is based upon helping healthcare providers do what do they do best by giving them that feedback and then giving the patient and the general population feedback so that they can get an idea of where their next step is, where do they need to go.
And with that, have you ever come across anyone ask you to look at EDS or any connective tissue disorders? Is the thermal imaging something you can look at? So I'm also hypermobile. And so lipedema and HEDS obviously is connective tissue. So some of my gut stuff is connective tissue. Can you see that on a thermal image, or does it read hot or cold, or is it a little bit more nuanced?
It's a little more nuanced because what we have to look at is what happened to the connective tissue and how is the circulation affected in that situation. Now, some of the connective tissue is down too deep, so we're not seeing it. So in that case, we need something that would make it show up at the surface. A lot of times it's either a nerve reflex or there's enough heat building up, or it's close enough to the surface where we can see it. So there's a lot of variables. I wouldn't be able to sit there and say yes or no as far as is it valuable? I think there's some possibilities, but I don't think we've got that particular condition dialed in at the same level as some of the others.
Yeah, I think that kind of probably all my conditions are a little more on the fringe of how much information you have in the allopathic sort of research to kind of compare to,
Yeah.
where there's not that it doesn't exist, but there's not a lot of research. Then you could say okay, in all these 10,000 study participants, all these things happen and we gave them thermal imaging and then look at all these things that are kind of aligned. They're hot in this place, they're cold in that other. If they have this thing going on, then,
Yeah. I mean,
ligaments,
often
blah,
what we're
blah, blah.
doing is
Right.
we're cross-correlating physiology with the image. So we're saying what physiologically happens with this condition to the tissue? How could that potentially affect the heat? Do I see a change that looks like it could be caused by that condition? Right. So if we're talking about rheumatoid arthritis, which is a big one, we see heat over joints. It's usually symmetrical for most of the time, but we can see that and it can be tracked. So the value isn't necessarily in the diagnosis of it because they've already gotten it, but it's the tracking as to how effective the treatment is and is the condition worsening or getting better over time. We have something a little more than symptoms and how everything looks visually and X-ray to evaluate it. What is the heat doing? If we see increased heat patterns, we have more inflammation. If we see fewer heat patterns, inflammation seems to be decreasing.
That would be a great test in addition to, I'm just thinking out loud, and because
Yeah.
lipedema is very underdiagnosed and it has the main thing with the symptoms. So you have your fat, which is visible, but there's a lot of pain and inflammation and lack of mobility. And then it starts affecting hips and things. So it'd be interesting, just as an aside, not that you have that, but to look at that on your body to see because the problem is with these kind of illnesses that I'm talking about is
Yeah.
that when you go to your doctor, if I don't look sick all the time, you wouldn't see oh my gosh, she looks like she has all these things and she's in constant pain. It's something that I've gotten adept to masking.
Yeah.
So when people look at me, they're like, oh, it's probably diet, exercise, like the normal stuff, or what's your age? I'm sure it's your hormones. But having a test like that to look at this is where I'm feeling pain constantly. And then having a test that even just if it's supposed to be, if it shows high heat in those areas, it would be a nice diagnostic tool that is not just subjective to
Right.
have and could point to, which sounds like even better for prevention and earlier detection and et cetera with everything. Because I think And all of these things that we talked about, maybe not rheumatoid arthritis because that could be genetic, or maybe EDS because that's genetic.
Mhm.
That's debatable. But a lot of the other things that if you know you have it, then you can change your lifestyle earlier to
Right.
help manage and maybe not prevent it all the way, but do a lot more to prevent it, hopefully. I mean, hopefully this next phase is all about prevention and having the understanding and a tool to kind of give you real-time feedback to make sure you're on the right track.
Yeah, exactly. And even if we don't have the evidence right now to say that it can be prevented, we have a lot of evidence with different conditions to say that risk factors can be lowered. I mean, even, these systemic diseases that are going on, we know that stress is a factor. We know that our sugar balance is a factor. We know that there's different things that influence all systemic diseases. So to be able to get a baseline, take an action, and then see how the body changes can be really valuable feedback as we attempt to move closer and closer to prevention.
Yeah, that's beautiful. Well, thank you so much for all this information. I learned a lot. I hope my questions are too out there, but I really do think that I mean, I know that you've been doing it for a while, so it's not new to you. And this technology sounds groundbreaking and like you're on the forefront of that. And really feel like a lot of times when people think like, oh, they just heard of something, people like you have been working on it for a really long time
Mhm.
and it's a passion. So it's not new, but it's maybe new to a wider audience.
Yeah.
So I really do hope that this technology gets into the hands of many people, including segues into more traditional hospitals, universities. And with AI, and that it's interesting that the Department of Defense funded it, a lot of things they are looking at like so many different things in the future.
Yeah.
I'm sure you're having that with like, in order for an AI to detect something wrong in the human body, they would need, I would think, something like a thermal scan, depending on how advanced they get. But like if, some people think that everything's going to AI, but if they were able to diagnose it, I would think that they would need like your technology overlaid with other parts of the human body
Oh, yeah, yeah.
in order to read it.
Thermal imaging is not diagnostic, let's say for breast cancer. It's just to direct other tests. That's the goal. The AI is just going to be used to try to get to the source of the problem faster and more reliably. And, there's some really good algorithms going on right now. I mean, a lot of the research is being done in, Latin America, Europe, Asia. There's tremendous research coming out on that. There's an Indian company that's already has their unit in hospitals with an AI algorithm for breast cancer. So this stuff is not that far away. As those types of things get proven more and more, then we might be able to talk, could this be used as a replacement for mammography as primary screening? Not complete replacement, but for primary screening. It's not there yet, but I think that with the AI algorithms and more research, we've got a shot. We're just going to have to see how it plays out.
Yeah, exactly. No, it sounds like it would
Yeah.
be amazing, especially so if anyone's young out there, if you're listening and you have daughters or even sons, because there's all sorts of cancers with men as well, to seek out and go to these links and get some baselines started if that's within your reach financially. But I do think it's important to have some diagnostic tools as you go through this. I know just in talking to you, I'm like, wish I would have known about this and did some before I started to change everything and really address all my issues, kind of give me a scan of where I'm at because it is subjective. Even when I do a lot of different treatments, I don't always know if they're working or not because things are happening on a cellular level or inside that I can't really feel. There's no tactile feel,
Right.
and I have so many aspects. So I just highly recommend that I'm going to go find a provider in my area to get that done. And I'll let you know, Dr. Kane, maybe in the future, if you want to come back, I'll have my tests I could show you. So we could talk a little bit more about that. But
Well, that could be fun.
yeah, because I really do think that having an additional sort of voice, and it sounds like this is just an additional sort of like, okay, this is what my doctor says. I'm doing that. I'm going to come in with this as either to help support what they've already found or help me, like you said, once you have that, maybe they could get additional tests. This could be the vehicle to explore more. So either it confirms what you're already seeing, or it might be like, it's time to like dive a little bit deeper.
That's
And
right.
those sorts of things also give you peace of mind because unfortunately, you said you've seen so many people with breast cancer, so many women, and there's so many other different types of cancer. But if you can prevent or start to prevent that or see it earlier, I really do think that it can at least help your journey more with some more support. I think the more supportive tools we have, better. So, are there any final words or anything we didn't say that you really want to say about thermal imaging and what you do, or to anyone out there about health in general?
Sure. Well, thank you for having me on and giving me the opportunity to speak. I really appreciate it. I hope I didn't talk too much in Latin and Greek, and what I was saying was understandable. I know sometimes it's the bane of having a clinical brain. You use terms and things like that aren't there. But my biggest message is it's a balance between getting information and trusting experts. And it's really important that as a patient, and this is true for me too, when I'm in the healthcare arena, you just have to be your own advocate and you have to decide who you can trust. Find those doctors, find those sources that you trust, and then work with them. Because it's not something you could do by yourself. You can't just randomly search on the internet and find out different things. Ultimately, you need someone to guide you, and that's what an expert's there for. My job is to provide tools. I think thermal imaging is a wonderful tool to give feedback. And I'm going to make sure it's available in as many places as possible so that anybody out there looking for feedback on their condition, whether it's diagnostics or risk reduction or treatment, that's available for them so they have all the pieces. Because that's what we're trying to do, make sure there's more pieces so we can get better results.
Beautifully said. Perfect. And I support you fully on your mission. So if anyone is interested in learning or wanting to bring that to their provider or practitioner, if you have a functional person where you think that this would fit right in, I highly recommend that you contact Dr. Kane, and all of this information will be in the show notes. So thank you again for listening, and bye for now.
Great. Bye-bye.
If this episode made you feel even more seen, brought you clarity, or reminded you that you're not alone, please take a moment to rate, review, and send it to someone who needs that same reminder. You can find more tools, blog posts, and support over at donnapiper.com. And hey, don't forget to subscribe so you never miss an episode. Got a question for me? Every month I do a listener coaching episode, and I'd love to hear from you. Send your questions, stories, or flare-up confessions to donna@donnapiper.com. And you just might hear your answer on the show. Until next time, dear body, I'm listening, and I am so glad that you are here.